Hi everyone, good evening again, and let's start. So I welcome you all to the Diabetes Masters course Series 2, and as we all know that Series 2 is all about diabetic pharmacotherapy, insulins, and OHAs, right? So we'll be covering all about the types of insulin in this insulin therapy and utilization. Let me share the screen, then only you can understand better. Okay, so yeah, I think you must have gone through this. So this is the another course what we are conducting, in collaboration with university. So I would like to thank the university, the Geetanjali University and Geetanjali Institute of Pharmacy, Professor Mahendra Singh Rathore, for this wonderful collaboration and giving us this opportunity to conduct this course along with the university, right? So you all know that you all will be getting the certificates from the university along with the CliMed, right? So this is a certified course from the university, and you all will be getting the certificates even if you are attending only one series or two series or three series or the entire master's master certificate course. You will get all the certificates issued by the university, right? That is Geetanjali University and Geetanjali Institute of Pharmacy, right? So our this season 2, the series 2, is all about diabetic pharmacotherapy. Here we'll be talking about the drugs, okay, and their mechanisms, their classifications, their side effects, contraindications, how to avoid, what to avoid, how to individualize the therapies in different diabetes. Because in first class, in the first season, we have talked about the individualization of the therapy, right? The individualization of the therapy and how to go ahead with the things and what exactly the diabetes is and the types of diabetes, so that we have taken care in the series 1. And now we are going to talk about diabetic pharmacotherapy, diabetic management, right? So this is the 8-week course, 2 months course, and the classes will be every Thursday. So your first class will be on 26th, right? Your first class will be on 26th Thursday. So we'll be starting with the uh, OHAs, and before that we'll be talking about the algorithm to treat the diabetes. Okay, so in that I'll be even touching upon the guidelines, the current guidelines, the 2023 ADA guidelines, American Diabetic Association guidelines. So they launch the guidelines every year. 1st of the January they launch the guidelines. So I'll be touching upon the guidelines also, and I'll be talking about the algorithms. And then we'll be going to slowly we'll be going to all the OHAs, their classes, their contraindications, their mechanism of action, and when to give. That's important, like when to give, right? Such as pioglitazones we cannot give in the cardiac patients, right? And sulfonyl ureas we cannot give in the kidney problem patients, like who have the chronic kidney disease or acute kidney disease. So some of the sulfonyl ureas are banned in those patients, right? And like what is the common cases, what are the common drugs for all the patients. So that all will be discussed in this series, right? You can see here type of insulin, insulin therapy and utilization, dosing and administration, individualization of the insulin therapy, oral hypoglycemic drugs, pathophysiology and MOAs for all, monitoring and adverse event management, and the case discussions. So I want to know from you, like this time I'm trying to change the method a little bit, because sometimes we take the classes from the slides and all. So this time I'm thinking like every class, because we are talking about the drugs only, right? We are talking about the drugs, either their mechanism of action, their classes, whatever is there. So why don't we start with the cases? All the classes I want to start with the cases. Like let's take one case and then follow that case with all clinical side, and then jump upon the treatment part, right? The guidelines, the medications, what are the medications we can give, what are the medications we can suggest, what are the best preferred medications for such patients in different cases, right? So what do you think, guys? How we should go ahead with the cases, or with the slides, the direct slides or the guidelines, whatever you will suggest, I'll go ahead with that. Okay, so we'll be starting that course from the from the Thursday. Now I would like to hear from you what you think about the classes and how we should take. And the class timings will be the same from the 7 o'clock, right guys? 7 o'clock in the evening every Thursday there will be a class, right? So we can complete this course within 2 months, right? And yeah, that's all from my side. And now I'm okay to take the classes as well, so we can take the classes, we can start the classes. So please tell me if anything from your side, guys. Yes guys, I'm asking for some suggestions for your queries. If you have anything, please tell me. Only 1/4 of the students have joined this class anyways, less than that. So this time things will not go like that. You have to get the proper attendance also, right guys? Then only things will work out between us. Otherwise you'll not get the certificate at the end and you'll be fighting with me. Anyways, if you have no suggestions, no questions, then we can take off. It was just the formality of the induction, so we can start the classes by Thursday. Stay tuned, we'll be updating everything in the group. Don't again telling you, don't ignore the group, because this time I'll be sharing the exercises also. I have prepared some exercises for the group, so you have to get the exercises done also. Okay, chalo, if no comments, no suggestions, then take care guys. We'll see you on the Thursday. Bye.